Can just 2 weeks of reducing sugar help decrease fatty liver disease? The answer is yes, according to a new study. And what's even more important, and this was in adolescents. I'm Dr. Brett Scher, the medical director at dietdoctor.com. And on the one hand, you could say this study kind of falls under the, well, no kidding category. If you reduce dietary sugar, you're likely going to improve things like fatty liver. But on the other hand, I thought this was impressive because one, the time frame, only 8 weeks, and two, it wasn't like they went on a completely low-carb diet or a completely keto diet. All they did was reduce the sugar they were taking, and it had a significant effect. And that's really encouraging because, especially for adolescents, it can be really challenging to get them to follow a true low-carb diet or especially a true ketogenic diet. But for a simple change like this of just reducing your sugar, showing a significant and pretty dramatic decrease in what's called hepatic de novo lipogenesis, meaning the liver making new fat, lipogenesis, new fatty acids, which contributes to fatty liver disease. So to be able to reduce that significantly in only 8 weeks without a dramatic dietary change, just reducing sugar, is really encouraging. So that's the overall conclusion. Let's go into some of the details of the study. So first, these were adolescents, and they were randomized to either decreasing their sugar or continuing their current dietary intake. And here's one thing that's interesting. Again, this wasn't necessarily a low-carb diet. So both groups at baseline were between 46 and 49% carbohydrates. And then after 8 weeks, the treatment group that reduced their sugar was down to 42% carbohydrates. So still not by any means a low-carb diet at all. But their free sugar intake went from 9% of their calories to 1% of their calories. So it's you can do it, right? We show that they showed it's an effective intervention, that you can lower your sugar intake dramatically to a much lower level, whereas the control group lowered it from 13% down to 11%. So pretty mild decrease there. And then the results were significant. I mean, the hepatic fat, the liver fat measured by MRI, was a score of 19 in the controls, which really didn't change. It was a score of 25 in the intervention group, so higher to start with, and decreased all the way down to 17.9. So a decrease there. The liver function tests improved as well, as did their glucose and insulin levels. So that's interesting too, because metabolic disease goes along with fatty liver disease. So just reducing the sugar in the diet not only improved fatty liver, but it also improved markers of metabolic function with glucose and insulin improving. And that was also mirrored in their triglycerides, with their triglycerides getting better. All the things we expect with reducing sugar, improving your diet. Now, the other thing is, it wasn't because of a dramatic weight change. I mean, they lost from 91.1 kilograms down to 89.7 kilograms. Not a big dramatic change. So it really was the dietary change that did it, not the weight loss, or at least that's what it appears based on these data. And then the other main outcome was the de novo lipogenesis, which decreased by 3% in the control group and 30% in the treatment group. So very significant decrease there. So look, again, this falls into the category of no big surprise. And we have lots of information at dietdoctor.com about treating fatty liver disease with low-carb diets, what the evidence says. And it's clear, it's an effective treatment, and low-carb diets work. But what this study shows is it doesn't necessarily have to be a low-carb diet. So for some people who are more hesitant or reluctant to try a low-carb diet, target the sugar. And this really shows that even a simple intervention such as targeting the sugar is going to improve fatty liver. But beyond that, it's going to improve glucose, it's going to improve insulin, it's going to improve triglycerides, it's going to improve metabolic health in general. And that's the key. You don't want something that's just going to target one aspect of a disease when the disease really is a systemic problem. And that's what it is with fatty liver frequently. It's a systemic problem of insulin resistance, of metabolic dysfunction. And so targeting the systemic problem with a dietary change, even when as simple as lowering the sugar, makes a difference. So don't get discouraged if you or your adolescent or your loved one isn't open to adopting a low-carb or keto diet. Make the change they'll do. Start with the sugar, and you're going to see some benefits. All right, I hope this was helpful. If it was, click the thumbs up and subscribe, and we'll see you next time here on Diet Doctor News on YouTube. Thanks a lot, everybody.